right, so it looks like we'll get started. Hi,
Okay.
my name is Jody Brockman. I'm a nurse here at North Kansas City Hospital, Meritas Health, and I have the pleasure of partnering with Amanda Trout from the Gilda's Club. Amanda is the program director at Gilda's Club, Kansas City, which is a local network partner of the cancer support community, whose mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Prior to her current role at Gilda's Club, she spent 11 years working as a clinical social worker and adolescent and young adult program coordinator in the Division of Hematology Oncology, BMT at Children's Mercy Hospital. Amanda has over 20 years experience as a licensed social worker in various settings throughout the Kansas City community. She is passionate about psychosocial support for those impacted by cancer, promoting health equity, and creating and fostering communities of support. And today we are lucky to have her presenting a very important topic, mental health and cancer. Um, and we'll just give that to you, Amanda, and you can take it away.
Okay. Awesome. Thank you, Jody. I appreciate it. I'm very excited to be here today. And as she mentioned, I'm Amanda Trout, the program director at Gilda's Club, Kansas City. And we're going to be discussing patient and caregivers guide to understanding mental health and cancer today. And I just want to share, so these slides were created by the cancer support community, and this is who medically reviewed the slides. So these were developed by CSC, and we are able to use them today. And this is just my contact information in case anybody wants to take that down. If you have questions later, I'm absolutely happy to answer them and be available as a resource. Jody already shared the mission of Gilda's Club Kansas City, so I won't repeat that. But what we're going to do today, before we even get started, I like to kind of have a grounding activity. And you do not need to share with me in this moment what you're thinking, but I would love for all of you who are watching today to think about how things have been going for you in the past month or a few weeks, and what comes to mind in terms of emotions that you've been experiencing. And just kind of recognize and ground yourself where you are today as you receive this information. So that's something just to keep in mind and maybe have in your mind, or take some notes while we're talking. The agenda today is really to recognize and understand mental health, right? So we're going to talk about what mental health is and why it matters. In broad sense, we're then going to shift to talking about mental health and cancer specifically, identifying emotions and feelings, discussing survivorship and mental health, caregivers and mental health, and then additional kind of options and supports available for patients and caregivers, including ongoing self-care options. So what is mental health and why does it matter? Mental health is really a combination of psychological, emotional, and social well-being. So it's how we think, how we feel, and how we connect with others. Now, of course, our feelings are very fluctuating, right? They change from day to day. It's really normal to have ebbs and flows across time. You don't very rarely feel one emotion throughout an entire day or even an entire hour. Um, you might have a certain event or trigger that can, last a long time and cause you to feel certain emotions. These emotional responses we have to events in our lives, whether they're long term or short term, can influence your overall mental health. And it matters because mental health is just as important as physical health. You can't separate the two. Our brains are part of our bodies, right? And so it's not like we can take care of our body without taking care of our brain. And it's not like the things that go wrong with our body don't impact our brain and vice versa. So It's really important to try to be physically and mentally well, both at the same time. That's not an easy task necessarily, but they go hand in hand. So some factors that might affect your mental health. I'm sure everyone that's watching today has their own ideas and own experiences of what this looks like, but there can be all kinds of things that can affect your mental health. Our school and work and responsibilities, difficult conversations and family dynamics or friends, coworkers, facing a serious illness such as cancer. Maybe there's financial concerns. Maybe you've had to move away from a community and you're trying to find a path in your new space. Maybe there has been a death of a family member or friend. Maybe there's deadlines you need to meet, right? All of those things can impact your mental health. And you might have more than one of these things going on at the same time. Um, these kinds of things can impact everybody differently, right? Nobody's going to have the same response as somebody else. But whatever your response is, those emotions are valid. That's the most important thing to remember. Um, so in terms of mental health, I think we often think about mental health as, thinking about what's wrong, thinking about what is causing stress and distress. But there's good things about mental health, right? There might have been good times in your life or in your even recent past where you might have felt good about your mental health and checking in and thinking, okay, what helped me feel that way? What was helping my mental health be in a good space? And then also on the flip side, thinking about what has impacted it to not be good when our mental health was not well. What factors caused it? Or is it kind of hard to figure it out? Sometimes you just feel cranky and you're not really sure why. And that's okay. Um, sometimes the the trigger or the thing that's making us feel a certain way, it is important to try to figure it out. But even if you can't, the most important thing is figuring out how to move forward from that, how to cope, and how to address the situation. And we'll get into some strategies for that here in a little bit. So, kind of taking a poll here, you know, for example, if you had a close friend who was going through something in silence, right? Going through a really difficult thing, would you want them to reach out and talk to you? Probably so, right? We care about our loved ones and we want to be there for them. But often we feel like we don't want to burden someone else, right? That's a pretty common thing. We sometimes feel like we don't deserve that same support that we actually want to give to our friends and family. And sometimes we just don't give ourselves um, that space to say, you know what, I'm important too, and it's okay for me to need this help. So often when I hear somebody say, oh, I don't want to burden someone or I don't want to, cause anybody stress, I flip the question and say, but what if it was, your friend, your sister, your mom, you would want to talk to them, right? You would want them to come to you and you would, offer them that support. You deserve the same thing. The reason why, though, sometimes we don't feel like we deserve that support is that there is stigma around mental health. Um, this is a pretty long-standing thing and it's different in different cultures, it's different in different families, but that stigma can make it hard for us to prioritize mental health. Um, Sometimes there's messaging around, just pulling yourself up by your bootstraps, just toughing it out, and just kind of forging ahead. And well, sometimes we may need to do that to get through a minute or a day. It doesn't help us in the long term. Putting your health first and your mental health first is really important in terms of being able to kind of handle things in the long run. The stigma that I'm talking about, these are kind of common messages we hear that creates that stigma, right? That mental health is a sign of weakness or that you're a lesser person. Maybe the problem isn't real. You're not choosing to be happy. You don't have reason to struggle, or I don't want to talk to a stranger about my problems. These are some messaging that we sometimes hear that make it hard for us to, ignore these types of messages. But really, emotional concerns, those ebbs and flows, mental health, stress is really, really normal. Um, you know, it's really normal for these stressful situations to challenge your health. We, you know, there's a lot of focus on physical health, right? And we know we're supposed to get our annual checkups and we're supposed to, try to eat healthy and exercise to maintain our physical health. Mental health really needs to be treated the same way. Taking the steps to benefit your mental health is just as important as those physical health steps. So, what helps, right? Talking about it. Um, People sometimes mask what they're really feeling, right? We might not know that our friend or loved one is struggling because they're hiding it, right? They're kind of putting on that brave face. Um, and when they do that, or when any of us might do that, we might feel alone. But it's hard for people to know if we're struggling if we don't talk about it, if we don't, um, you know, allow ourselves to be vulnerable. It's hard to be vulnerable. It requires a lot of strength. But when you are, and when you do open up to whoever that person is in your life, it can really help. And you might find that that person also has their own, um, struggles, and you might be able to kind of talk through that together. It's the first step in finding that support is just admitting that maybe you might need it. So, what are emotions or feelings? Mental health includes lots of moving parts. Breaking down kind of the important words, the things we hear often, can really help us understand our own mental health. The ups and downs are normal, like I said, but there's different types of treatment and support options depending on what the emotional health concerns are and how they're impacting your quality of life. So, we talk a lot about emotional balance, right? And trying to be balanced. It's hard because it's to try to keep ourselves constantly even is not really realistic. There's going to be times we feel lower, times we feel happier. Um, Recognizing when we feel low, when we feel high, those are really important to determine kind of what those community and environmental things are that are impacting us in that way. And there are some specific emotions that may impact mental health. Anxiety is one, right? This is a feeling of uneasiness or worry. It usually occurs because of a stressful event or a series of stressful events. You can have very physical feelings with anxiety. You can feel tense, your shoulders, your neck, maybe. Your heart can feel like it's racing. You might feel clammy hands or, lightheaded. These are things that the anxiety can cause, and it does cause a very physical manifestations. Grief is another emotional response, and it's a response to loss. It may not mean necessarily death. We often think of grief as being an emotional response to death, and that's absolutely true. But you might have a loss of a relationship, or a change in your health, or a loss of control, a loss of a job or of a person in your life. These are all things that can cause that grief response. Stress. So it could be caused by being overwhelmed, right? By physically, mentally, or emotionally, or maybe more than one of those things at a time. An event, a trauma, an illness. Um, these are things that can cause stress. And it's very possible that you might experience anxiety, grief, and stress all at once, or more than one of these at a time. That's very normal. And it can be hard to kind of differentiate between those different emotional responses sometimes. Now, depression, this is more of a clinical diagnosis that's given by a medical or mental health professional. And this is more of a persistent feeling of sadness or loss, where you just feel like you don't like the things or don't find joy in the things that you used to enjoy. It's very, very normal for people who have cancer to experience depression or anxiety after receiving that diagnosis. And that is also true for caregivers. Approximately 27% of cancer patients do experience depression. It's really important to recognize the signs of depression because of this. There's no shame in it. It's just important to recognize those signs so that you can access the support that you might need. And so what are the signs? Loss of pleasure or interest in things you usually enjoy doing. Maybe normally you like to, have dinner with your family every night, and maybe you suddenly just don't want to do that. Um, Feelings of worthlessness or hopelessness consistently. Maybe change in eating or sleeping habits. And that could be eating too much or not eating enough. It could be sleeping too much or not sleeping enough or having disrupted sleep. And so if you experience any of these things for at least 2 weeks, it's really important to seek out help. And these resources here on this slide, calling 988, that's a crisis line. You can contact Gilda's Club Kansas City. We're more than happy to try to help and get you connected. And then the Cancer Support Community Helpline, I will provide that contact information later. They are a great resource as well. Mental illness. So this is something that is diagnosed by a mental health or medical professional and is something that is a prolonged over a certain period of time. The thing about cancer is it doesn't discriminate, right? You might already have mental health needs. You might already have depression or another mental health disorder, and then you might get cancer also, right? So then you're dealing with both. If you do have that mental health issue or mental health diagnosis prior to the cancer diagnosis, it's really important to share that so that you can figure out how to balance your medical and mental health care at the same time. Being open with your treatment team, being open with your mental health providers, trying to get them all to talk to one another is really important to make sure you're getting the best care that you may need. And then suicidality. So this is always a tricky subject because it's really hard to talk about, but it's so important. Suicidal ideation is thoughts or ideas about death or suicide. I will say it is very normal when you have a cancer diagnosis to think about death. That is a very normal thing. It doesn't mean you want to die. It doesn't mean you plan to, but it's normal to think about how a cancer diagnosis might impact your life and whether your life expectancy might be shorter. That doesn't mean that you're suicidal. It doesn't mean that you're in crisis. It's really normal. So I just want to make that clear. But suicidality is a risk of suicide, and that is usually indicated by really serious suicidal ideation that leads to a plan or intent to act on those thoughts. So if you find yourself, thinking about ways that you might end your life, that is really important to reach out for help. Or if you're a caregiver and you notice things in your loved one, maybe they're more withdrawn, maybe mood swings are really prevalent or extreme, maybe you're noticing impulsive behavior, it's important to reach out for help and try to get support if you're noticing these things. There are this crisis line, the 988 phone number, or you can dial the whole 800 number, is the National Suicide Prevention Hotline in the US. You can also text that 988 number, and there are skilled clinicians available to walk you through things and make sure that you're safe and make sure you're connected to the resources that you need. And, even if you aren't feeling suicidal ideation, but you're just needing support or feeling, like you're experiencing a crisis or having a hard time managing what you're going through, you can reach out to this number. And these are open 24/7. So we've reviewed kind of just general mental health, right? Now we're going to connect sort of the thoughts about that general mental health information and cancer together. So thinking now about what emotions you have experienced as a person with cancer or a caregiver when you or your loved one was diagnosed. And I'd encourage you to think about or write down these emotions and what you've kind of experienced during that process. And we're going to talk a little bit more about what these are. But I think it's really important to know that if you've experienced mental health struggles and emotional concerns during cancer treatment or even after treatment, you're not alone. Um, in 2022, the Cancer Support Communities Helpline shared that that the most people, the top reason that people called the hotline or the helpline was to talk about coping and get support options. Um, and so that shows that that's really usually at top of mind for people who are trying to cope with and deal with a cancer diagnosis. So the same helpline data shows us that 74% of people that called were worried about the future. That's really, really, really high numbers, right? So if you are worried about the future, 74% of people are also worried about the future. And this is only people that have reported it, right? There might be even more than that. 60% felt sad or depressed, and 64% felt nervous or afraid. These are really high percentages. So this is very impactful, right? And we want to make sure that we know this so that we can continue to share the resources and support that folks need. So when you have a cancer diagnosis or your loved one has a cancer diagnosis, as a patient or caregiver, it's really normal to feel new emotions and have a lot of questions. Fear or worry is very common. Anxiety, sadness, loss of hope, uncertainty about the next steps. These are all very common concerns in your head. You can find your head spinning, right? And just, flipping through all of these thoughts at the same time. Um, you might have people asking you how you're feeling, and it might be hard to explain it because maybe you're feeling lots of things at once. But as honest as you can be with your support system and with that are concerned about you, the better you will be able to cope with those concerns. So this is just sort of a reflection moment as we move forward. What new emotions have you experienced since you received your cancer diagnosis? Is there something new that is kind of on your mind that wasn't there before? Fear and worry, as I mentioned, very common. Fear of the unknown, fear about how your family or job may be impacted, worrying about your own health and appearance changes, and then fear about losing independence, right? When you when this is such new information, a diagnosis and what treatment may look like, there's lots of unknowns. And even if you hear all of the plans and hear all of the potential side effects, we don't know how we're going to respond to something. And that can be really hard. As humans, we really want to control everything that we can. And this is something that's very much out of our control, and that can cause some significant distress. You may feel some anxiety. Suddenly you're managing doctor's appointments and balancing appointments with responsibilities. Maybe you're a parent and you're trying to take care of your kids and figure out how to manage your treatment. Maybe you're not sure what the future is going to look like or how to talk to your friends in your support system. Sadness and loss of hope. You may have a hard time understanding why or how this happened. That's a really common question, just wondering why is this happening to me? What did I do? What's wrong? Sadness about not overcoming a diagnosis and concern about dying, as I mentioned before, are very real concerns, and they're very valid concerns. And that loss of control, again, is very, very valid and can cause significant distress. That uncertainty about next steps. How might your life change? What are the side effects going to look like? How am I going to overcome this? How am I going to live well with and through this situation? So one tool that is used, and this is sometimes used in cancer centers, and it's also something that we use at Gilda's Club KC, and the cancer support community as a whole uses this, is a distress screener. And it's a type of questionnaire that your medical team or that if you access support through Gilda's Club, we might ask you to complete it. And it's really something to help understand what are your current concerns in various areas: emotional health, financial health, well-being, physical health. So if we know what your concerns are, then we're better able to support you and connect you to what you need. And again, when you are yourself going through this, it can be very overwhelming to figure out, I don't even know what my top concerns are. And so completing a questionnaire like this as a patient or caregiver can also help you kind of prioritize, oh, okay, I completed this and now I know my biggest concern is nutrition or my biggest concern is financial. And then you know kind of where to start in terms of getting support. So as I mentioned before, you may come to receive a cancer diagnosis and you already have mental health concerns that you're dealing with. Um, that's very common, especially post-pandemic. Lots of people are continuing to struggle with increased mental health needs once or through the pandemic, and so it's even more prevalent than ever before. And so, if you come to a cancer diagnosis and you already have these mental health challenges in place, it's really important to talk to your health team and say, hey, I already am diagnosed with depression. I'm taking this medication and now I need to have chemo. How is that going to work? How are those things going to interact? What kind of special, supports might I need or might you have for me? Asking those questions is a really important way to advocate for yourself. So, you get this cancer diagnosis and what's next? Like what do I do? What are the next steps? What happens? It might be really hard to um, feel comfortable managing that diagnosis and other parts of your life. It's really common to feel like maybe things are moving too fast. You're trying to balance work and parenting or work and caring for grandchildren or school, wherever you're at in your life. And it can be really hard to balance all of those things and cope. There's a lot to organize and manage just in regular day-to-day life. And then if you add the cancer diagnosis and all the appointments and everything on top of it, it can begin to feel pretty overwhelming. And, it's really important to share with your healthcare team how that's going for you. They may or may not remember to ask you how you're doing from an emotional health standpoint, but it's really important to share anyway. It's okay to say, hey, I need to take a minute and talk to you because I'm really struggling today. And I know you wanted to talk to me about my labs, but I really need to talk to you about how my life is going and I'm really stressed. So who do you talk to, right? Your oncology team is usually the best place to start. You may have a certain person in that team that you feel a good connection with, right? My advice is always to start with that person. So if it's your oncologist or if it's a clinic nurse or a nurse navigator, whoever it is that you feel most comfortable talking to is the best person to talk to. And if they need to loop in other people, they will do that. There's also additional members of the team, sometimes available through the health system. There may be a social worker available or a therapist or psychologist. There may be a psychiatrist or a spiritual services. These are sometimes team members you can access. If you haven't met them, you can ask to meet with them. Or, you also can reach out to community supports. And of course, that here locally is your local Gilda's Club. Or you can call the Cancer Support Community Helpline. But there may be other resources out there through church, perhaps through school or family support system, or a gym, anywhere that you already feel a sense of community. It's okay to kind of reach out for extra support through those communities as well. So when you're in with any treatment that you're given for your cancer, you want to always inform your care team if you have new changes in your emotions related to mental health, right? So if you notice after a few weeks of treatment that you feel more anxious or you feel some of those signs of depression or you feel some of those signs of grief, make sure you mention it. There might be ways that your treatment plan can be altered or accounted for in order to help you manage your mental health. Sometimes treatment can cause mental health concerns or symptoms that mimic mental health concerns. So it's really important to keep both of those things top of mind and keep communicating with your care team. So in terms of supports that are available, you know, supports can be available at any stage. There, you might want support that's specific to your cancer type, specific to your cancer stage. Um, you might want supports dependent on your specific diagnosis, the where you are in treatment, or if you're post-treatment, or other demographics, right? Maybe you are a woman going through breast cancer treatment and you really want to connect with another woman going through breast cancer treatment, for example, or you're a young adult and you want to connect with other young adults. That's very common and very normal. So it's important to kind of figure out what are the things that are going to be the most helpful for you. If you have those specific needs, it's a good place to start. And there's lots of different ways to access this kind of support and lots of different kinds of support that are available. So there's, of course, one-on-one therapy with a therapist. There's group therapy, which is typically led by a licensed mental health provider. And this is usually where we have multiple, patients or caregivers together, and the licensed mental health provider is there to help facilitate discussion and support. A support group is similar to group therapy, but is sometimes led by a peer, maybe not a licensed mental health provider, but another person who's been through treatment is leading that group. Peer-to-peer mentorship, that can be a one-on-one match with a peer. Maybe you want to just talk to somebody else that's been through similar treatment so that you can get some feedback and ask questions. And then a helpline, that is usually associated with an organization to offer more support specific to what you need. So the Cancer Support Community Helpline, for example, or the 988 Crisis Line, those are both examples. And then there's other community resources like church, local, your cancer support center, Gilda's Club, even your treatment center may have other resources available to you. And then kind of switching gears a little bit and talking about survivorship, right? And I know that word is sometimes, triggering. Some people really identify as a cancer survivor. Some people don't love that term. It's a very personal thing. But for purposes of this conversation, the survivorship term really means when you're done with the bulk of your treatment. And so we're talking about when you're done with the active treatment that's been completed. So whether that's chemotherapy or radiation, surgery, for example, if you're done with that, we're going to be calling that survivorship. And you may, though, still be taking medication to help with side effects or to help, prevent any future issues from happening. And so it doesn't mean that, everything is back to the way it was before. You might have kind of a new normal you're dealing with. And emotions after treatment can be really complex. We tend to see an increase in anxiety when people are about to be done with treatment or when they are done with treatment, because sort of that security blanket of having treatment is done. Often you are, maybe you've been seeing your oncology team very frequently. And then maybe when you're done with that active treatment, they only want you to come back every 3 months. And that can be kind of jarring and can kind of leave folks feeling lost sometimes. You might be really happy that it's over. You might also be cautiously optimistic, or you might be really scared. You might be all of those things at once. And it's hard to have those mixed emotions and mixed feelings because it can leave us feeling really confused and exhausted. But it's very normal to have those mixed feelings, and it's important to hold space for both. Scan anxiety. This is really important to talk about because this is so common. And this is the type of anxiety that tends to occur maybe right before you're about to get a follow-up test. So whether that's a CT scan or an MRI, or maybe it's labs, maybe it's an ultrasound, whatever that looks like for your particular kind of cancer, this tends to spike right before those tests. And it's very, very common. But it is definitely really, really hard. And, when you experience that kind of thing, it's important not to just Google randomly, because you never know what's going to be um, sort of reliable information. But it is important to mention it to your medical team or reach out to those support systems during this time so that you can get really, um, you can get information that is reliable, that is specific to your situation, without kind of going down the rabbit hole of all the possible things that could happen. So mental health after active treatment, how can you handle it, right? What can you do? What are the things that are in your control when there's so much that isn't? Trying to focus on the things that you enjoy. Um, Trying to, engage in healthy habits or activities, eating a healthy diet, practicing healthy sleep habits, um, taking steps to engage in physical activity. And this doesn't have to be, going to the gym 5 days a week and taking the hardest class there is. It could just be going for a walk 3 days a week, or it could be doing yoga at home or in a class. It doesn't have to be really hard. It doesn't have to be really extensive, but it's finding the things that are attainable for you, setting those goals that you think you can actually achieve, and that will help you feel real, successful and that you've achieved something that you have control over. It's really important to kind of be intentional and taking that time to take care of yourself. I know it's hard when you're balancing so many activities, but it is really important. And then getting back to your new normal, right? So what does this mean? I think I hear a lot that when somebody is first diagnosed with cancer, they, I often hear, I'm ready for my treatment to be done so that I can get back to how things were. And we begin to realize that there's no way to erase the cancer experience, right? It's always part of your story, but doesn't have to define you. And so what does this new normal look like? What does going back to work full time after my treatment look like? How have my relationships been impacted? How do I, parent my kids? How do I deal with intimacy with my partner? Talking about finances and just our general responsibilities. Um, it's the new normal isn't the same as the normal you had before, but it can be still a really good positive place. The trick is figuring out how to cope through and make those adjustments. And so one of the most common concerns we hear about is that fear of recurrence. Even if you're done with treatment, um, there's often this kind of nagging wonder in the back of someone's mind, is this going to come back? What happens if it does? That's so super, super normal. And when you start to notice those kind of nagging thoughts, talk about them. Share with your family, share with your support system, reach out to those support groups and mental health supports, engage in those stress reducing activities. And, sometimes there's also a palliative care team available in certain health systems. And that's really just a team to help you talk about managing symptoms so that you can, live as well as you possibly can right now. And then just making sure you're staying connected and not isolating yourself. So support during survivorship. As I mentioned before, there are support groups and peer mentoring during treatment. These are also true for post-treatment. Gilda's Club has a post-treatment support group, specifically for people that are in that phase. We also do some classes about that transition from in treatment to post-treatment. There can also be peer support around that issue. And then making sure you ask your team about a survivorship care plan. So what that looks like is, okay, now I'm done with my treatment. Tell me what my follow-up looks like. Tell me what symptoms or health issues I need to be worried about. What do I need to monitor? What specialists do I need to see? I often hear every ache and pain that somebody feels once they're off at treatment, they begin to worry that that's cancer coming back. And that is super common, super normal. But finding out what are the things I really need to worry about so that every ache and pain isn't making you think your cancer is coming back, because you know that knowledge is power. These are the things that you really need to worry about, and these are the things that you don't. So we also, it's important to kind of take moments for mindfulness, right? And that doesn't have to be complicated. We all have busy day-to-day lives. It can be hard to find moments to just recenter ourselves, but you can take just 5 minutes to, and maybe even fewer than that. If you don't have 5 minutes, you could take 3 minutes. Maybe you close your eyes, you turn off your screens, and you put your phone on do not disturb, and you sit and you just breathe deep breaths in and out. Maybe you have the time to take a walk or go step outside and breathe some fresh air. Those little things that you can do and integrate throughout your day can really help you keep feeling centered as time moves on. There's also lots of really good mindfulness apps that you can find on your phone, YouTube channels that give you free information and little mindfulness sessions that you can do. So if you're not sure where to start, you can use those tools to begin to figure out what works for you. And then caregivers. I've talked some about caregivers throughout this presentation, but it's really important to know. Caregivers themselves have their own worries and concerns. And the same survey that surveyed patients found that 68% of caregivers were worried about the future. 59% felt nervous or afraid, and 59% felt sad or depressed. Those, again, are very high percentages, showing you that if you're a caregiver and you're feeling this way, you are not alone. There are others that are with you in that feeling, and there are absolutely resources out there for you as well. Gilda's Club does have caregiver support groups. There's other resources out there that you can access. So I'm sure you've heard before, it's difficult to pour from an empty cup. I sometimes also think about the analogy, if you've ever flown on a plane before, the flight attendants, when they're going through all their safety talks, they say if there's an issue, you need to put the oxygen mask on your kid before you put it on yourself, right? Or I'm sorry, put it on yourself before you put it on your kid. I said that wrong. You've got to take care of yourself in order for you to take care of others. So that can be hard to do, because by nature, a lot of us really just, we worry about our families, we worry about our friends, and we want to do everything we can for them. And sometimes we run ourselves down if we're not taking care of ourselves. And especially if you're a caregiver, if you are caregiving somebody that has a cancer diagnosis, putting them first is a very normal thing to want to do. And it's not necessarily wrong, but you've got to also take care of yourself in order to be there for them. It's normal to feel scared, stressed, or worried. It's really, really hard to be a caregiver. It can also bring a lot of joy. There's a lot of value in it. But caring for your own health is really important. Otherwise, it can be really common to experience burnout as a caregiver. So, what is available to you as a caregiver? You can also talk to the healthcare team. You can ask for help. There are support groups for caregivers. There's therapy available for caregivers. It's okay to ask for help with those caregiving responsibilities. It's often too much for one person, and it's okay to ask for help. We understand you want to do anything and everything that you can to take care of your loved one, but that can also lead to feeling overwhelmed, and there could be somebody else that you could kind of subcontract to help with some of the stuff, to take some things off your plate. Again, some of the common challenges that we see among caregivers is feeling stressed about how your life might change, right? This is also happening to you in a different way. Feeling worried or fearful, trying to manage finances and kids and your loved ones, and balancing your own responsibilities with caregiving your loved one. it's really important to know your emotions and your feelings about this are just as valid as somebody else who is going through the treatment themselves. So we're going to talk a little bit more about some additional options for patients and caregivers that are available to you. In terms of support options, therapy with a licensed therapist, counselor, or psychologist, talking with somebody at the helpline about your mental health concerns. I will mention, so I know sometimes accessing mental health care and accessing a therapist can be hard. Sometimes there's wait lists, sometimes insurance doesn't cover it. It can be complicated. So just for all of you to know, Gilda's Club, Kansas City does offer free, everything that we offer is free of charge. And we can offer short-term individual or family counseling, usually around 6 to 8 sessions. And that is free of charge. Sometimes that helps if you're waiting to get into an appointment with a therapist that can't get you in for 6 or 8 weeks. You might be able to bridge that, or maybe you just need a few sessions. That's definitely something we can help with. The Cancer Support Community Helpline is that 888 number there. The National Alliance on Mental Illness contact information. They often have great resources and referrals. And then again, that 988 helpline is available. Sometimes medication can help with managing mental health needs. And this is something that you would need to talk to about with your care team, right? Your oncology team. They may have you talk to a psychiatrist, or they may themselves be comfortable prescribing something for you. But they would probably also encourage you to reach out to a therapist as well, if that's an option. And also, if you're thinking about taking any new medications, you want to make sure you talk with your care team about it to make sure there's no interactions between taking a new medication and the treatments that you may be taking as well. And that ongoing self-care, right? What are the things we can continue to do? Anything you enjoy. These ladies here seem to enjoy swimming, so that's what they're doing. But whether that's cooking, whether that's going for a walk, whether that's family game night, anything that you enjoy doing, try to do what you can, even if it doesn't look the same as it did before. Working on kind of taking control of those emotions with coping skills when you're feeling overwhelmed or distressed, focusing on things that are within your control. And some of those things are sleeping and physical activity and eating habits, trying to eat healthy as best you can, trying to have good sleep hygiene, meaning going to bed, prioritizing sleep, going to bed without screens, not avoiding caffeine later in the day. All of that kind of stuff can help you with sleep. And then even when you're experiencing fatigue, which can be very real and very hard when you're in cancer treatment, that fatigue is bone tired, right? It's not just that you didn't get enough sleep. Trying to move your body can actually help combat that fatigue. So even if it's just taking a few extra steps a day or doing some stretches, that can really help maintain your mental health. And then connecting, right? Being isolated is something that can really negatively impact your mental health. And as humans, we need that community. Whether that community is your family, whether that community is found at Gilda's Club or a church or somewhere else, being surrounded by community can really help us feel like we're not alone. Maybe make some plans and try something new, right? Start a new hobby. Maybe you are able to schedule a trip. You can still make plans, even if you're not sure what the future holds. Sometimes those plans have to change. That's just life, right? But it's okay to make plans and have something to look forward to. And then, again, connecting with your community in whatever way, works for you. That physical activity. I kind of talked about this already, but trying to be physically active, moving your body in any way that could be walking to the end of your driveway and back. It could be stretching or, doing some very gentle yoga. You can learn, talk to your care team about if there's any limitations, of course, to what you should be doing. But that physical activity can really help promote mental health and mental wellness. as can healthy eating, right? I know when you're in treatment, it can be hard because things taste different. We digest things differently. So often, usually most cancer centers have a registered dietitian that you can reach out to get some tips, but that what we put in our bodies helps fuel us. And it is really important to try as best we can to eat the things that are going to make us feel our best. And then integrative medicine. So these are things that are not necessarily traditional treatments, medical treatments, but are complementary. So acupuncture is something that you can explore. Again, checking with your healthcare team to see if it's appropriate. Yoga or meditation, aromatherapy, massage therapy, music therapy, and art therapy. All of these kinds of things are different ways to learn how to cope, different ways that can promote mental health and mental wellness. And then some additional resources. So, um, as I mentioned before, these are national support resources. The Cancer Support Community Helpline is available. It's available in 200 languages, and they can help get you connected to resources in your community or other national resources that may be helpful. National Alliance on Mental Illness is specific for mental health concerns. American Cancer Society has some great resources. So I'm not going to read all of these for you, but these are all available and can be really good places to start if you're not sure, what you need. And then here locally, Gilda's Club Kansas City, of course, we would love to support you, whether you're a patient or caregiver. That's what we're here for. We have support groups for patients and caregivers, for kids, for teens. We have a bereavement support group, and we also have a post-treatment support group, and we have a Spanish-speaking support group. We also have educational and healthy lifestyle programming. So some of those complementary therapies, we have art therapy every month. We do have a yoga class every month, knitting and crochet. Workshops like the one I'm doing now, we offer. And then we have short-term counseling that we can offer, and we offer opportunities for social interaction as well as resources and referrals. If there's something that we don't offer that somebody needs, we'll try to get it to them. And then Turning Point is another really great resource here locally that's affiliated with KU Health System, but they have support for anybody impacted by a chronic illness, and that does include some cancer resources, and we collaborate with them for lots of programming as well. So kind of in conclusion here, I like to kind of end with, again, some reflection. So thinking about one thing that you can integrate into your daily life, given what we discussed today. So whether that's a mindfulness moment or reaching out to a support group, thinking about something that you might want to try after kind of thinking about what we've discussed today. And that is all I have for you. I really, really appreciate the time to chat. I know I flew through a lot of information, but you're always welcome to reach out to me with any concerns, any questions. We are definitely here to help provide that support.
Wow, what great information. And Amanda, you have such a reassuring, soothing presence.
Well, thank you.
It's
I appreciate that.
Yeah, it's easy to see the impact you and Gilda's Club can have on people who are facing these huge challenges related to a cancer diagnosis.
Well, I appreciate that. And I'm super passionate about it. I've been doing this a long time. And, I just love to see those connections be made within that community. So whatever we can do, we are happy to do it.
Great, great. Okay, guys. Well, I will be emailing you a YouTube link to all who signed up online, and you can feel free to share this link with someone who you feel like could benefit from this information. You can also go to nkch.org/class to find all of our upcoming presentations and events that are going on in the community. So I thank you guys for joining us today and enjoy this beautiful fall weather and have a great weekend.
Thanks, everyone.
All right, thank you. Bye-bye.